World Cancer Day is a global observance that helps raise people's awareness of cancer and how to detect, prevent, or treat it. Cancer is a leading cause of death around the world.
I am Dr. Nwanne Shagaya. I am a clinical oncologist, the consultant at the National Hospital Abuja in the Department of Oncology and Radiotherapy.
My name is Dr. Tamna Mebi Thompson Wakama. I'm a consultant hematologist at the National Hospital Abuja and a senior lecturer at the Department of Hematology, University of Abuja College of Health Sciences.
I have Dr. Estienne here with me. She is the head of Department of Hematology and who has interest in hemato-oncology.
Cancer refers to any one of a large number of diseases characterized by the development of abnormal cells that divide uncontrollably and have the ability to infiltrate and destroy normal body tissue. Cancer often has the ability to spread throughout one's body. It is the second leading cause of death in the world.
The word cancer actually comes from crab, as we know it. Of course, you know the crab with so many fingers and, spreading out. So that's what, cancer is likened to be, like a crab, tentacles and spreading out. And, So cancer is generally an abnormal growth when anything becomes uncontrollable, when it's growing, so to speak. And not only just growing, because you can have something that is growing that is not cancer. So it's not every growth that is cancer. But it becomes cancerous when it begins to spread to other parts and becomes uncontrollable. Because as we know, most of the cells in the body, most of the time, they are regulated because there are proteins that regulate growth. But in cancer, that regulatory component is lost. So the cell continues to grow and grow and grow and begin to spread to other parts. And if untreated, of course, can lead to death.
It is not one disease. It's actually a group of over 200 different distinct genomic diseases that share certain characteristics. One, it's a non-purposeful growth, which is uncontrollable. And two, it is a non-stoppable process. It is the refusal of the body to be able to control these cells. All cells of the body can have cancer. Every human being can have cancer. Any age can be afflicted by cancer.
It cannot be really true that cancer is a death sentence. Why am I saying that? Because you can have cancer and live with it, and there are some cancers that are curable. So not that anybody who has cancer, hope is lost and therefore is going to die. So that is not really true, because cancer, some forms of cancer can actually be cured, and some can be managed or treated, and patients can actually have good quality of life and live a reasonable good life. Okay. As of now, the extent that medicine has brought us to. So we're in an era where cancer can actually be said to be treated.
Some of the most common signs and symptoms of cancer. Although every case is different, some general signs and symptoms of cancer include weight loss, loss of appetite, cough, or indigestion, among others.
It's not possible to know you have cancer. Even I, as I'm sitting here, I can't know. But I can know the warning signs, and I can know the right thing to do when I have any of those warning signs. There's something I would like to really share. It's called the warning signs of cancer. It spells the word caution. C-A-U-T-I-O-N, caution. The C is for a change in bowel habits. So if you just suddenly start to notice that you don't go to the loo the way you used to go to the loo, either more frequent or less frequent, that is significant. Please seek help from the appropriate people. A is a sore that will not heal. This sore could be anywhere in the body, as long as it's a sore that is refusing to heal. You know, normally you have a normal sore, you've done the basic first aid, and it is just going on and on. It is significant. See a doctor. U is an unusual discharge or bleeding. Any part of the body that is exuding a discharge, no matter the color or whatever, as long as it's unusual and it's persistent. And when I say persistent, I'm not talking about you have to wait for 3 months. No, 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 no. Any bleeding that is not your regular monthly cycle bleeding, or as a man bleeding from an abnormal place, please see a doctor. T, thickness or a lump in the breast or anywhere in the body. You're better off going to the hospital and they tell you, oh, it's fine, than you assuming and then later on finding out it was something more sinister. I is for indigestion or difficulty in swallowing. You know, sometimes people will just wake up and say, oh, you know, now I'm not able to eat late at night, or when I eat this. Don't assume things. If something is not your norm, listen to your body. Go to the hospital, and don't just go to the hospital and expect the doctor to catch on. Let them know what your worries are. I've come because I have this, and I was told it's something I should check out. O is an obvious mole or what? Because we're dark-skinned, this might be a little bit difficult to see, but basically if you have like a birthmark that suddenly starts engaging, enlarging in size, or itching, or becomes raised, you should see a doctor. And the last one is a nagging cough or hoarseness of your voice. Cough that will, come, go, you should see a doctor. Or hoarseness. If you, a lady who all of a sudden your voice changes. Initially you may say, oh, I sang too much yesterday, or I was exposed to cold. That's fine. But if it persists, please see the specialist and let them know. Okay, so I've just gone over the danger signs of cancer. This is not the full sign. It's not the full list, but it's enough to empower you to catch on early.
Blood cancers affect the production and function of the blood cells. Most of those cancers start in the bone marrow, where the blood is produced. Cancer
That affects cells of the blood can be said to be cancer of the blood, okay? And as you know, there are the major cells in the blood are the red cells, the white cells, and the platelets, okay? But when we talk about blood cancer, mainly what is commonly known is the cancer of the white blood cells, which sometimes we call leukemia and sometimes lymphoma and myeloma. But there are other forms, of course, the red cells too. There are some precancerous states, what we call the polycythemia, where the red cells just begin to grow and grow and grow, and then can also become some cancerous. The red cells, of course, as we know, the major function is to carry oxygen from the various parts of the body, and then carbon dioxide is left out. The white cells help to fight infection, okay? So they are the soldiers of the body, so to speak. And there are two major types, the neutrophils or the myeloid cells, and then the lymphocytes or the lymphoid cells. The myeloid cells actually attack any foreign body, whether it is virus or bacterial or any other foreign body, by actually, engulfing the whatever target and destroying it, so to speak. But the lymphoid ones produce antibodies, and antibodies are proteins that recognize anything that is foreign and try to attack the foreign body to destroy it. So you have the myeloid cells and then the lymphoid cells, but both of them can become cancerous. And of course, in most of the cases, you have what we call this cancer in blood is also divided into two major forms, the leukemias. You have the acute leukemias and the chronic leukemias. Okay, acute in the sense that those who have the acute leukemia, the progression is faster, and the chance of cure is also very limited. But those who have chronic leukemias have a slow growth, and then the patients just continue, you know, they can live on for a long period of time, and although the problems are not really very sudden, but if untreated, some of them can transform to the acute form, and of course, invariably, if not treated, they can also, you know, die from the leukemia. But you have the acute leukemias and the chronic leukemias. Those are the two major ones. The myelomas are also cells from the lymphoid cells, which also produce antibodies, and when they are formed from one particular cell in the bone marrow, which is the stem cell, and the stem cell is the cell that now differentiates or proliferates. In other words, it regenerates itself and also differentiates to other forms, because from one cell you now have the red blood cell, the white blood cell, the platelets and all that. And then also from the red blood cells, you have various white blood cells. Okay, you have the neutrophils, the lymphocytes and all that. So there's an organized way that the body has in making sure that things go properly. But in cancer, all this, you know, organized form is lost. And so you now have cells that just grow out of control. Okay, so from the bone marrow, you find out that the cells now, you know, are pushed into the peripheral blood cells and also into other organs. Okay, so there's abnormality in both function and in production. So you have abnormal growth, and then you have abnormal number because you have a high number of cells, and then you have these cells that are formed are no longer as functional as the normal cells. So because they're no longer functional, the normal function that these cells are supposed to carry out is no longer carried out. For example, I said the white cells fight infection. So the cells that are now being formed are not able to fight infection, so the person begins to have frequent infections. Okay, and then also because these abnormal cells are being, you know, produced in the marrow, the normal cells that are supposed to now fight infection are no longer being formed, and so the patient frequently has infections. And then the red cells also are no longer being formed because the marrow has been taken over by these cancer cells. So the person now begins to lack blood. So all the time the person is weak, he has no blood, they have to transfuse him and all that. And then the other part of the blood cells, which are the platelets, which help to, you know, make blood to stop when there's a bleeding. But because these platelets are no longer being formed, the person continues to bleed. So the normal functioning of the body is lost. And of course, the immunity is also suppressed, and therefore the patient is prone to so many infections and all that. So the most common things are that the patient will commonly come down with infections. There's anemia, which is lack of blood, and then platelets are low or not existent, and the patients have difficulty in making sure that blood, you know, when there's a cut, or the patient have even abnormal bleeding even when there's no cut.
Many cancers and the abnormal cells that compose the cancer tissue are further identified by the name of the tissue that the abnormal cells originated from. There are different types of cancer, which includes breast cancer, lung cancer, cervical cancer, blood cancer, among others, and others.
You can have cancer of any part of the body. Every cell in the body can be afflicted by cancer. However, we have common ones. The ones that are common for men, the ones that are common for women. And in Nigeria, in the order of frequency, the most common is breast, followed by cervix, followed by prostate, colon and rectum, liver, and lymphoma. The breast, believe you me, cancer of the breast can also affect men. Even though they don't have breasts that are as big as that of women, they also can have breast cancer. So it's something we all must have at the back of our minds. If you have a lump or anything abnormal in the breast area, seek professional help. The cervix is the neck of the womb in a woman. It's quite common. We see it all the time. However, it's one of the few cancers that if you do 1 or 2 interventions, it's almost, in quote, almost preventable. So, you get those vaccines. That I will go, as we talk along the line, I will mention how we can prevent this. But for just everyday, things like bleeding abnormally, unusual discharge, all these things will pick out all these other malignancies I've mentioned. Prostate, only men have prostate cancer. As men get older, naturally their prostate gland tends to increase. A certain percentage of them will have cancers. If a man starts to have difficulty passing urine, or dribbling, when he wants to finish, he's still dribbling, or a feeling of incomplete emptying of the bladder, these are things that he should check. It's been going on for a while. Yes, you're an old man, but it's something significant. Go in to see your doctor, see your GP. Mention to him, he knows what to do, and if it is something that needs to be further tested, he will. If he finds it something not sinister, he will also tell you, you haven't lost anything. And then the colon and rectum, these are actually the intestines. Cancer of the colon, believe you me, if caught early, can be treated with just surgery. People have, this, impression that cancer is a killer. Once you have cancer, that's it. It is when it is advanced, then it becomes difficult to manage. But if you catch it early, it is definitely treatable. 1/3 of cancers are preventable. 1/3 of cancers, if caught early, are treatable. 2/3 of cancer can be handled. That surely is something very encouraging. And of course, we have the non-Hodgkin's lymphoma. This is a bit more too medical, I don't really want to go into, but if you find abnormal swellings at the areas where I call checkpoints in the body, lymph nodes are little swellings that people have from either, infections or malignancies, that's cancers. They're all over the body. How will you and I feel them? We'll feel abnormal swellings in the armpit, along the neck, the groin area. There are things that you find. So like as I said earlier in the caution signs, an abnormal swelling, see a doctor.
Each type of blood cancer is different, but they can share some common symptoms and signs. Some people may not have symptoms until the disease is advanced, or sometimes the symptoms may be mistaken for a severe cold or fluid. Fever, frequent infections, loss of appetite.
Unfortunately, the symptoms for blood cancers are almost like the symptoms of malaria. So a lot of times, a lot of our patients come in late, and then you get the history that you've been having fever, malaria, a few body pains and all that for about 2-3 months. But they had been treating for malaria, or in the more common parlance, malaria and typhoid. So what happens is that they get the treatment, the temporary relief, and then they fall ill again. So if that keeps happening several times. So what we would usually advocate is that not only for all our patients, we advocate that everybody should at least have once a year go for your yearly medical checkup, because there are some people whose cancers have just been detected from their yearly medical checkup. And for those ones, they're usually the earlier cancers, and those ones have to go for most because they picked up early, they start treatment early, and so they will survive.
Patients with cancer of the blood come late to the hospital for treatment because either they've been misdiagnosed or they were not even thinking of that in that treatment. Patients should be investigated properly. Resources are limited, and so that can be a challenge also for the doctor who is attending to this patient. The basics should be done by trying to investigate this patient properly and on time, rather than treating for something over and over. Patient is there with you 1 week, 2 weeks, 3 weeks, is not getting better. And then by the time you are referring the patient, one has exhausted all his resources. 2 is coming to the referred place at a point when his condition is almost, irredeemable. My advice to the general practitioner or to people outside is see every patient, try to do the basic investigations that you need to do, because that, of course, investigations or treatment starts from taking the history. That gives you an idea. You examine the patient thoroughly Okay, that increases your chance of diagnosis, and then you support that with the basic tests that you need to do. If the facilities are not available, then you refer this patient to a place where he can, get better care and better treatment. So if these things are done, you find out that most patients can benefit from, the attention of the specialist by the time they come. But most of the time, they come rather very late.
Cancer can occur due to biological or internal factors, such as age, gender, inherited genetic defects, skin type, environmental exposure, and others.
Well, it's good we address, because you see, we are Africans. So it's good we address the reality that we live in. Cancer is a disease that is made up of the person's genetic makeup. Like we say in Nigeria, it's in my blood. There's a way we say it carelessly. They say in that family they have this thing. It is a genetic thing. The genetics in combination with the outer environmental influences are what make up the cancer becoming, evident. Is it a spiritual attack? No, it is not a spiritual attack. And why am I so sure? Because I can treat it with scientific means. So that's why I'm so sure. I'm not saying that when we treat, we shouldn't pray. No. I believe as a doctor, I treat, but God heals. So what do I advocate? See your doctor, get the treatment, but of course you have to pray, because it's only through the prayers that the treatment will convert to healing. Radiation
can also go beyond the atomic bombs and all that, even the x-rays and all that, and that's why most of the time you find out that when a woman is pregnant, you avoid doing x-rays, except it is absolutely necessary. So all these are things that can give rise to cancers. But the issue of spiritual matter, well, of course, we are spiritual people, so most of the time we always believe that every sickness is caused by attack, or yes, but we know, at least science has given us evidence that, this is something that has gone wrong, because I don't want to go into the technicalities of what we call mutations and genes and all that.
Cancer is more curable when detected early, although some cancers develop completely without symptoms. So it is important that people limit their risk factors and undergo appropriate cancer screening.
There are definitely some that are more dangerous. Why do we say they're more dangerous? There are those that, the way they progress from one end to the other is so fast. There are those that by the time they present themselves, they're already very advanced. And I told you, the cancer has to be caught early for it to be treatable. Now, if we're able to do the 1/3 early detection, we're able to do the 1/3 prevention, the remaining 1/3 are the ones that we talk about when we talk about them being really dangerous. There are some malignancies that are really difficult to manage. By the time you find them, the patient is a stage 4, and that becomes, difficult. For a woman, and even a man, but a woman's own is a little bit more significant. Every month, you really should do a self-breast exam. You time it for just after your monthly cycle, because before your monthly cycle, your breasts tend to be tender and may mask whatever is underneath. So you wait for right the week after your monthly cycle. You stand in front of the mirror. Take off your clothes. Stand in front of the mirror and look at yourself. Look at your breast, and you're looking for one, disparity, asymmetry. Most women, one breast is bigger than the other. This is fine. It has always been the patient's normal. Now we're looking for something out of the ordinary for this index person. So she stands there, you look at the mirror, you look at the breast, look at the nipples. Are they both pointing the new way they used to point? You look. Then you raise up one arm. Let us say we're starting off with the right breast. You can actually raise the arm over your head like this, looking at the mirror, and you use your left hand to examine this breast. You imagine that you've divided the breast into 4 segments, and you use this hand to feel. Bearing in mind that you're not a doctor or a nurse or even a trained personnel. What are you looking for? Any abnormal swelling, any lump that is abnormal. If you're able to do this every month, once you find something abnormal, you go further and seek professional help. That doctor is going to check, confirm the absence or presence of this lump, and then do further imaging, maybe an ultrasound or even a mammogram, depending on the patient's age, and then they will take it from there. But every month, a woman should attempt to make sure she does the self-breast exam.
Leukemias are actually blood cancers, so unlike the oncology cancers, they are not solid tumors. So for a lot of our patients, you don't see any solid swellings or anything, but you see the blood. When we take a blood sample and look under the microscope, we see the features of blood cancers. So blood cancers, there are different types of blood cancers. The commonest being the leukemias. We have the chronic leukemias and the acute leukemias. So for the chronic leukemias, you have the chronic myeloid leukemia, the chronic lymphocytic leukemia. Those are the commonest we see. We also have the acute leukemias, that's the acute myeloid leukemia and acute lymphoblastic leukemias. We also have multiple myeloma as well as the lymphomas. So that's generally the scope of, we have myeloproliferative neoplasms as well. Then our scope is not as wide as the solid tumors, but we do have quite a number of cancer cases. And the commonest for us are the non-Hodgkin's lymphomas, followed by the chronic myeloid, the chronic leukemias, then the myelomas. And they are managed by us, and we also use chemotherapy. In a few instances, we call on the oncologist to do radiotherapy for us when we have run out of our chemotherapy.
A recurrence occurs when the cancer comes back after treatment. This can happen weeks, months, or even years after the primary or original cancer was treated.
There's a tendency and there's a possibility of reoccurrence. So you can treat, and besides, you can actually treat one form of cancer and the patient can also develop another form of cancer as a result of the treatment that was given for the initial cancer. But having said that, even without a secondary cancer, or what we call a secondary cancer, the patient can actually develop a reoccurrence of the primary cancer that had been treated before. Because sometimes what happens is that when cancer has been treated, well, by all intents and purposes, it appears that everything had been taken care of. But there may be one cancer cell somewhere which was not detected. And that can, like I said, cancer is abnormal growth, okay? So it begins to grow and grow again, and then it can also, recur. So yes, there's a tendency that cancer can recur.
This is where it's very sad. You can treat a patient for cancer and do so well, achieve cure. Patient remission, in fact, like I said, achieve cure. But there's still a 25 to 30% chance of recurrence in most malignancies. So it can happen, and that's the reason why after treatment, they have to continue with the follow-ups. Because even if that recurrence is going to happen, you want to catch it early. Because if it's caught early, you can still take them back to curing.
The best way to fight cancers is by prevention and early detection. Cancer treatment advances every year, and combined with early detection has made many cancers treatable.
Prostate cancer is the most common cancer in males. It tends to be more common when they get older. Normally, an elderly man, as he gets older, he's going to find that his urinary stream will reduce, the strength will reduce. He may find when he goes to urinate, when he wants to stop, he still has what we call a terminal dribble. Towards the end, he still dribbles, and sometimes may even wet his trousers with a few drops. Sometimes he goes to urinate and then finds out that a few minutes later, 30 minutes, he feels like going back, incomplete emptying. All these are signs of a prostate that is either enlarged or there's an issue. At this point, don't assume and say, oh, I'm getting old. Go see your doctor. When you see the doctor, he will, one, examine, do a rectal exam, where his aim is to actually feel the prostate gland. He can actually feel if there are abnormal swellings, because you and I can't just feel our own prostate. A doctor has to check for this one. He will feel the prostate and tell you whether he feels you are a candidate that needs to have a biopsy or not. He will order a blood test where they will do the serum prostatic specific antigen. Based on the levels, based on his examination findings, and then some other imaging he may ask for, he can now tell you whether to go on to do a biopsy and if it is a cancer or not. So it is not unusual to have those symptoms, but a certain percentage of those older men that have the symptoms have a cancer that is hiding. It is also not impossible to have both an enlarged prostate and a prostate cancer coexisting. So it is very important that the right doctors are seen.
There are different types of blood cancers. Some have good prognosis, some have a poor prognosis. So yes, there's some of them that have poor prognosis, but the prognosis will depend on the stage of the disease, the age of the disease, and the chemotherapy. Fortunately for us, science is working at really rapid speed, and now we have what is called targeted therapy, which is tailored chemotherapy. So you'll see 2-3 different people with the same cancers, but using different treatment options based on their results. So it's not true that blood cancers are all blood cancers will die. We have survivors from blood cancers as well.
People should seek medical advice for anything that you have, because what you have and you think is nothing may be something more than what you are actually thinking, especially like I said in blood cancers, okay? Because by the time you realize that you have this, it may be too late. So people should avoid self-medication, and especially even if they have to, should avoid concoctions that also give rise to complications, okay? Because most of the things that they take eventually affect other organs of the body, the liver, the kidney, and all that. So by the time they are coming with multi-system problems, okay, not only the major problem they have, but because of the things that they have taken, they come down with so many problems. So penny wise, pound foolish. So while you think that you may be saving some money by just going to buy tablet and all that, that money can be used to seek proper medical advice. And if that is done, you may be saving your life, and you may be saving, extra costs, because at the end of it all, if you are seen early and treated early, maybe you may not get to the point where you now have to spend so much, or you are not able to take care of the problem, okay? So I'll advise that people seek urgent medical attention when there's need, and especially if you have treated yourself for malaria and it's not going 1 to 3 days, I think you should seek medical advice, proper medical advice.
I agree, accessing healthcare on any disease is difficult sometimes. But something? I work at the National Hospital. I hear people say many things, but my department, I can assure you, whatever you need, you will get. What I advise people to do is, 1, be patient. Sometimes people come to the hospital, it's a crowd. It has to be, 1 patient at a time. Eventually, you'll be attended to. If you have any of those things I have mentioned to you, if you go to the GOPD, the general outpatients, you see a doctor and you tell them, I've come here because of this, this, and this. You'll be asked to do certain investigations, and then they will refer you to the oncology department. I assure you, it is not as difficult. A lot of people just have that preconceived notion, and they're reluctant to come. But I'm assuring you, it's not that difficult, regardless of the fact that it's a government hospital. And it's not just here. All the other hospitals, just go, the thing is to go to the right place. You start off with the GOPD, and then you transition through gently, gently, and you will come. If you are hearing this lecture and you go through this process and it doesn't work out, come to the National Hospital, come to the Department of Oncology, and ask to see any of the consultants, and I'm assuring you, we will sort out your problem.
About About a third of cancers could be prevented with lifestyle changes. That's roughly 1 million cases of cancer in different countries each year.
Cancer is real, and there are different types of cancers. And to say that, like we started at the beginning, cancer is not necessarily a death sentence, but if steps are taken early enough, okay, they can actually be cured in some cancers, or they can be managed and they can improve their quality of life and live longer and live well, even with the cancer, okay? And of course, also to know the risk factors. Lifestyle, is very important also in cancer. What am I saying? Lifestyle. People smoke. That's a lifestyle. People eat junk. People eat unnecessary everything that today people eat. And some of them are detrimental to the health.
People sometimes forget, and we're so caught up in going to the hospital that we don't realize that there are a lot of things we could have been doing at home to prevent having these cancers. From our everyday lives. One, we have the sun that we all love so much. You must protect yourself from the harmful rays of the sun. The sun actually has ultraviolet rays that have been implicated in skin cancers, especially for the albino patients. You should avoid that midday sun, and you can, if you must come out, cover yourself or use creams that have got UV protection. SPF 30 all the way to 45 can be quite effective. Get immunized against hepatitis B. Hepatitis B and C have been implicated in the etiology of cancers, especially cancer of the liver. Hepatitis B, you can actually take vaccination, and when you take it, you are clear. I mean, if you have a cancer that you already know, if I can be vaccinated against, I will be making sure I cannot have it. That is fantastic. I mean, this is something that we really must take advantage of. Get immunized against hepatitis B. Hepatitis B is transmitted through blood products or body fluids, essentially. The next one is the cervical cancer, which is number 2 on the list. And there's a vaccine that has been shown to actually reduce the chances by, it removes 98% chance of one getting it if you're able to get the vaccine. It's called, there are 2 that are marketed, but it's against the human papilloma virus. This virus is sexually transmitted, and it's something you really want to key into if possible. Specific advice for women: learn the breast exam I just showed you. Perform it once a month. Get a pelvic exam once a year. Do the pap smear once a year. And of course, with the pap smear, if you have 2 consecutive ones that are normal, you can actually do it every 3 years. So get it done. Go to the hospital. Some of these things are even free. It's just that most of us are reluctant to go to the hospital. But I'm hoping after this discussion, many of us are going to get up, go to the hospital, and do some of these things. And of course, get your daughters and sons vaccinated against the human papilloma virus. Advice for men: have your blood PSA done from age 45, and do that every year. Get a rectal exam done from that age 45 as well. Avoid smoking, exercise for 30 minutes, 3 times a week. And then the colonoscopy. I've talked so much and I haven't said much about it. I'm going to throw more light on this. I mentioned cancer of the colon being one of the few cancers that if you catch it early and you do surgery, you're done. No chemotherapy that everybody's scared of, no radiotherapy, none of all that. How do you find cancer of the colon? By doing a colonoscopy. Basically, it's just like putting in a scope with a light and a camera through the anus, and they look all the way into the intestines. It's an amazing investigation that what it stands to gain for the patient is so significant. And guess what? You do a colonoscopy, it's good. The next one is due 10 years down the line. So there is no reason why we shouldn't just take our lives into our hands and do some of this. The theme of this year is I am and I will. If cancer is found early, and you get the treatment from the appropriate people, It's amazing. I have patients who are still coming to the clinic 15 years down the line. They were lucky. So I advocate for every World Cancer Day. I'm so passionate about this. Having people have this word go, and I tell you, it is free. These lectures are free. Get people, talk to doctors, to, wherever you feel you can get the word out, get it out. Because by the time you are treating cancer down the line, you are spending so much. But if you caught it early, you would have been spending just a fraction of what you end up spending. So this scourge of cancer in Nigeria, that we're seeing today, is treatable. All we have to do, you and I, have to do something about it.
Occupational cancer is caused wholly or partly by exposure to a cancer-causing agent, carcinogen, at work, or by a particular set of circumstances at work. Cancer is not a single disease with a single case or treatment. It develops when cells in the body grow in an uncontrolled or abnormal way.
There's also some occupational, things that people do. There are people who work in certain places. For example, somebody works in an asbestos industry, okay? Because of the asbestos, if he doesn't take the necessary steps, he can come down with, cancer. But then there are steps that he can take to prevent that. Even in industries where they provide these things for people to use to avoid coming down with this thing they don't use. So this is an avenue for people to know the risk factors and what steps to take, to prevent, coming down with cancer. Because when you have cancer, it is not only you, the whole family is affected, and the whole health system is affected, and everybody is affected. So if we can prevent, and which is possible in some of the cancers, it is better to prevent than waiting to get treatment, which can be very expensive and which sometimes may not give you the right result.
Any institution that has any source of radiation, workers that are exposed to radiation are at high risk. And there are modalities that are taken into cognizance to make sure this doesn't happen. The buildings have specifications. The institution has special licenses that they must get, and to get those licenses, certain criteria must be met. The staff walking around have got meters that they wear, which they use to measure the amount of radiation they've been exposed to over a period, maybe like 3 months, and they are read. And then at the end of each quarter, you read them, and then you decide on what to do based on the values you get. So yes, they are. People who work in agricultural firms, petroleum companies, there are a lot of companies that have asbestos companies, even farmers, people who do that storing of grains. They're exposed to some of this, things like aspergillosis with grains has been implicated in malignancy. So yes, they are occupational, but most of them will have in their SOPs of the departments, they will have criteria and things to do to protect the workers. For we, the medical people, we need to be compassionate. We're dealing with people who are going through a tough time. We need to be compassionate. We need to be empathic. We need to understand with them and try our best to do the best by them. For those who their radiation is through petroleum or through agriculture, I advise that they make sure they follow the SOPs of their institutions. It's extremely important. These are preventable scenarios. So please follow the SOPs, and then even if there's an exposure, follow the standard practices, the guidelines or the protocols set by the department for what to do when there's been an exposure.
What you eat can drastically affect many aspects of your health, including your risk of developing chronic diseases.
Zone in on diet per se. What we have are studies that have shown certain foods to be good. If you have a diet that is high in fiber, fruits and fiber, and antioxidants, definitely you're living a healthy life. And like I always tell my patients, and I want to use this opportunity to reach out to everyone out there, there isn't any special diet for the oncology patient. What we have is a healthy diet for the human being. For you and I, we should all have a healthy lifestyle. And if you follow this healthy lifestyle, you also will be preventing or putting yourself in a position where you're reducing the chances of having cancer. Now, I'm just going to go ahead immediately and mention what these healthy lifestyle choices are. The first one is to reduce or stop tobacco ingestion. Whether you're chewing it, you're smoking it, you're inhaling whatever, tobacco is the single most implicated risk factor in cancers. The next thing is frequent consumption of fruits and vegetables. I find sometimes in my clinic, patients come and when we talk about vegetables and fruits, they start wanting to import the most psychedelic fruits. You and I need to be reasonable. We need to stick to what we can sustain because it's going to be a lifestyle change. You don't want to start on vegetables that you can afford for only 2 months. No. Use your locally available vegetables that you can sustain for your lifetime. You introduce your family to it, it becomes a lifestyle. Another thing is physical activity. You know, a lot of us are beginning to live sedentary lifestyles. 30 minutes of active physical activity 3 times a week is sufficient. A brisk walk. You want to make sure your blood pressure is raised, you know, a little bit higher than normal. It's 120, 130. You really want to get your heart and your juices pumping. 30 minutes, 3 days a week is more than, you know. And then you do your yearly exams. There are certain tests that are important, the pap smear, the PSA, you know, those are things that you want to incorporate into one's lifestyle.
Then, the question has always been, is there any other alternative means of treating cancer apart from the conventional medical way?
I am a conventional doctor, so I will only feel comfortable talking about conventional methods. The reason being, when I was in medical school, I wasn't taught alternative medicine, and it's wrong for me to discuss what I know nothing about. Have I seen patients who do alternative medicine end up in my clinic having failed? Yes, I do. Have I met anybody that did only conventional alternative and was cured? No, I haven't. However, bear in mind, they wouldn't come to me if they were cured. Okay, so I am the wrong person to ask about alternative medicine. No, I'm not the right person. Do I advocate for the supplements and the cannabis oils and all those for cancer treatment? I'll tell you what, like I said at the very beginning, I expect and I advocate that the cancer patient and the normal human being on the street should have a healthy lifestyle, which includes diet, as well as exercise and healthy lifestyle choices. There is no special diet for the cancer patient. So when you talk about supplements, I will still take you back to, we live in a country where we have got, our agriculture is amazing. You go to the market, you see the fresh food we have. Eat healthy food, wholesome diets. That's what I would advocate for. I don't really believe in all the tablets that people are taking these days. I believe healthy, good, balanced diet is the answer.
Then it becomes advisable to listen to your body, maintain a healthy lifestyle, and go for a regular check. Cancer is not a death sentence.
Cancer is not a death sentence. Seek treatment early. Please do yourself a favor and make sure at least once a year you and your loved ones go out for a medical checkup.
Listen to your body. Give and take. The body would have given you a sign, but you either choose to ignore it or you assumed it wasn't important. So listen to your body. Those 7 caution signs I mentioned earlier on, have them in mind. Do your yearly exams, your pap smears, your PSAs, colonoscopy, and seek conventional medicine. The reason why I ask you to seek conventional medicine is because it has been tested. Still be spiritual. Pray. Pray to your God to, enhance that healing, but please seek methods that are conventional, have been tested and been shown to have proper results. It's World Cancer Day we're celebrating. I can and I will. take your life into your hands, yours and that of your loved ones.
So World Cancer Day is to enlighten people on the possible causes of cancer, and then also to let them know how to prevent, coming down with cancer where it is preventable. And the best way you can do it is regular medical checkup, okay? Because some of these things you can easily pick them up in the early stages. So if you have this annual medical checkup, you can also pick up when something is going wrong. And also, for example, if it is breast cancer, for as a woman, every time you check your breast to see whether there's a lump. If you're a man, if you have any lump or any pain anywhere, it's good that you seek attention immediately. And if you do this, a stitch in time saves 9. Okay, so we can actually prevent cancer, and where it is not preventable, we can actually take care of it early enough. And if it is properly diagnosed, you can take, for example, if a woman has a lump in the breast, okay? Now, if that lump is taken and tested and is said it's cancer, at that early stage, steps can be taken, either by way of taking care of removing the breast and giving chemotherapy and all that. So you prevent, spreading. But what we find is that most people come in what we call stage 4, when the cancer has spread to all the parts of the body, and there's hardly anything you can do other than say, okay, just palliative care, relieve pain and make the person a little bit comfortable until the time the person dies. So we are putting out this message to everyone to be conscious of the fact that cancer is real, and cancer can affect everybody, whether male or female, children, youths, and adults, and older people. And it can be prevented by regular checkup, by changing risky behavior, or changing lifestyle that predisposes to, ill health or cancer.
ACNN, reaching the world with the undiluted Word of God.